Hello everyone, welcome to our channel. In this video I'm going to talk about a drug. The drug name is Etoricoxib and this drug comes under the category of selective COX-2 inhibitor, belongs to the family of non-steroidal anti-inflammatory drug. And this Etoricoxib has not approved by FDA in the US market. Why? Because it has slightly increased the cardiovascular event like heart attack and stroke. Also it is associated with exacerbations of hypertension. Therefore, the manufacturing company received a non-approvable letter from US FDA for selling this product different countries with different brand names like Arcoxia, Etorix. Next one is uses. It is mainly used for moderate to severe pain. Also, it is used for inflammation and swelling, especially in the joints, like osteoarthritis, rheumatoid arthritis, gout, and ankylosing spondylitis, which means the inflammation occurred in spine and large joints. All suffix comes like itis, which means inflammations. So whenever the inflammation occurred in our joint, we have to take this Etoricoxib. It has inhibiting the activity of prostaglandin, which may leads to decrease the inflammation and swelling in our joints. And this Etoricoxib is used for moderate to severe pain and post-operative dental pain. Next, how does it work? Basically, our body produces two type of enzyme, which is cyclooxygenase 1 and 2. The short form is COX-1 and COX-2 enzyme, which may produce the prostaglandin synthesis. Once it synthesis, our body occurred inflammation and swelling in our joints. When we are going to take this Etoricoxib, it has inhibiting the activity of prostaglandin, by the way reduce the inflammation and swelling in our joints. You should not take this drug if you have any of these kind of issues. The first one is if you have allergic to this Etoricoxib or any of the ingredient of this drug, you should not take this. The second one, if you have any stomach related issues like ulcerative colitis, stomach ulcer and bleeding of the stomach and intestinal issues, you should not take this drug. And the third one is if you have liver and kidney disease, it's not preferable to you. The most important point is if you have any heart related issues like high blood pressure, heart attack or chest pain, which means angina, and you have already done the stent or CAPG surgery, coronary artery bypass graft. If you have done this, you should not take these drugs. Also, if you have had a stroke like a mini stroke or transient ischemic attack, which means temporarily lost the blood supply to the brain, because this Etoricoxib has slightly increased the risk of heart attack and stroke. That's why the FDA has not approved this drug in the US market. Next one is side effect. The most common side effect of this Etoricoxib is stomach pain, like stomach related issues. Other than that, we will feel sometimes ankle swelling, palpitations like abnormal heart rhythm or heart rate, and high blood pressures, and sometimes we will feel like sick, nausea, vomiting and wheezing, shortness of breath, chest pain and heartburn, indigestions. If you feel any of these side effect, you have to consult with your doctor and then you have to decide to take or not. I'm not mentioning here all side effect. If you feel any side effect after taking this Etoricoxib, you just stop to take these drugs. Next one is drug interaction. Here I am going to provide you most commonly used drugs interacting with this Etoricoxib. First one is AC inhibitor and potassium sparing diuretics. So both we can use for blood pressures. And the second one, salbutamol, we can use this for asthma. And lithium digoxin is for heart failure, and lithium we can use for depressions. And warfarin, it's an anticoagulant drug, and some of immune suppressant drug like cyclosporin and tacrolimus and methotrexate and rifampicin also interacting with this Etoricoxib. So all these drugs, if you are using concomitantly, either it may lead to toxicity or it may give therapeutic failure. And this Etoricoxib can be taken with low dose aspirin. If you are taking this aspirin currently for the prevention of heart attack, you should not stop taking this aspirin until you talk to your doctor. And let me explain in different video how this Etoricoxib interacting with each and every drug. We will see the pregnant women and breastfeeding women can take or not. Usually this tablet should not recommended to breastfeeding women and pregnant women. If you are plan to become pregnant or if you are pregnant, you should not take this drug. After consulting with doctor, take any better alternative drug. For breastfeeding, it is not known, which means there is no proof it will be excreted through human milk. If you are become plan to breastfeeding or if you are a breastfeeding woman, you should not take this drug. And for children and adolescent less than 16 years should not recommended this tablet. Also the storage, normally we can keep in room temperature. If I missed any valid point, you just message in the comments. I will also learn from you. Until then, bye, thanks.